Millions of people carry a virus that can silently damage the liver for years, long before symptoms ever appear. This is the story of hepatitis B. Hepatitis B virus, or HBV, is a partially double-stranded DNA virus belonging to the Hepatnaviridae family. It primarily infects hepatocytes, the main cells of the liver, where it begins its life cycle. This unique DNA virus is highly efficient at using the host cell's machinery to replicate. Hepatitis B spreads through blood and body fluids, including unprotected sexual contact and contaminated needles. Another critical route is mother-to-child transmission, which often occurs during childbirth. Once the virus reaches the liver, it enters hepatocytes and begins replicating deep inside the cells. The immune response against infected liver tissue contributes significantly to liver inflammation and injury. This battle between the virus and the immune system is what leads to progressive damage. Some patients completely eliminate the virus after an acute infection, building lifelong immunity. However, others develop chronic hepatitis B, where the virus persists for years or even decades. Chronic infection can progressively damage the liver, leading to fibrosis and cirrhosis. In its most severe forms, it can lead to liver failure, requiring urgent medical intervention. Chronic HBV is also a leading cause of hepatocellular carcinoma, a dangerous form of liver cancer. Blood tests can detect viral antigens and antibodies, allowing physicians to monitor the infection. Monitoring viral DNA levels is crucial to understanding the activity of the virus and the health of the liver. Antiviral medications can significantly suppress viral replication and reduce further liver damage. However, vaccination remains the most effective strategy to prevent the infection entirely. Modern medicine continues saving millions of lives, turning the tide against this global health challenge.